Welcome to Samba Samba. Enjoy the video.
You begin by mapping the curriculum and locking down exam dates. Once done, take a baseline test to show gaps. You should gather core resources, one anatomy atlas, one physiology text, question banks, and organize them by system. Make a daily plan with 2-3 focus study blocks and an active recall session. This creates momentum. Start small. Schedule your first 90-120-minute deep study block today, and make sure to note 3 weakest topics to tackle next. Once you have basics, shift to system-based cycles to connect anatomy, physiology, and pathology. This is how you convert facts into clinical reasoning. You must use active methods, spaced repetition for facts, flashcards for drugs and doses, and 30 to 50 targeted practice questions per topic to build retrieval fluency. Make cases central. Read one clinical case per study day and map it to symptoms, investigations, and management. Also, practice clinical skills and bedside reasoning during rotations to solidify what you learn. As exams approach, consolidate with full-timed mocks and targeted, high-yield reviews. Make sure to simulate exam conditions. You should schedule exam week logistics, consistent sleep, proper meals, required stationery, and a travel rehearsal one day before to reduce anxiety. During final revision, emphasize disease patterns, common presentations, and first-line treatments. If you stall or burn out, troubleshoot immediately. Cut your scope by about 30%, return to core systems, and rebuild momentum with short, focused study blocks and accountability.
Thanks for watching. Consider subscribing if we helped you.